Good afternoon and welcome to today's webinar. This is David Ford, the Executive Director of CalHIPSO. I want to thank everyone for joining us. I see we still have some attendees rolling in, but out of respect for everyone's time, we are going to go ahead and get started, and hopefully those folks can get caught up as we get going. Quick housekeeping item before we get started. All attendees, as you just heard, have been put on in listen-only mode, so you are muted during the broadcast. I think that's especially important because we have a lot of folks coming to this webinar. And so if you do have questions during the broadcast, we will have a Q&A section at the end. We would just ask that you would use the question box, which should appear on the right side of your screen. Type in your questions there. We will get to as many questions as we can at the end of the presentation, and then I know the IHA folks have already talked about maybe doing an FAQ or something depending on the volume of the questions we get after the broadcast. And to head off one question, because I know it's always the #1 question we get, the slides and the recording of this webinar should be available after the end of the presentation. I know from the CalHIPSO side, all of the CalHIPSO webinars are recorded and archived on the CalHIPSO webinar YouTube channel, so you can find the recordings there. We try to get those up 24 to 48 hours after any webinar. So with that, let's launch in real quickly to today's presentation. We are thrilled to be joined by our colleagues from the Integrated Healthcare Association to talk about the Symphony Provider Directory. This is a follow-up to a presentation some of you may have seen last fall. At the time, the Provider Directory utility was still kind of in the very early planning stages, and it was a little theoretical at the time. And so today, the project has been up and running for a while, and hopefully we can get some some updates on where it is and where it's going. But to start, let's so just for a quick background, especially on this webinar, where we've got a lot of folks, it looks like, who may not be as familiar with CalHIPSO. So I'll just go through a very, very quick update about who we are. CalHIPSO was a joint venture of the California Primary Care Association, the California Medical Association, the California Association of Public Hospitals and Health Systems. We were originally formed as one of the 62 federally designated regional extension centers, and our task was to help providers navigate the world of EHR adoption and utilization. And while that was our original charge to help providers get to meaningful use, currently we're branching out into a lot of different areas. We are still doing some work in meaningful use under the California Technical Assistance Program, but we're also doing projects about encounter data submission and a new project that we're just launching, but we're very excited about, to do practice transformation support for accountable care organizations formed by small practices and FQHCs. So that's us, and be on the lookout for us. We are growing and moving. And today, as I mentioned before, we are thrilled to be joined by our friends and colleagues from the Integrated Healthcare Association, who are the ones running the Provider Directory utility. So to kick things off, I'm going to pass control of this webinar to their CTO, John McBride. John, take it away.
All right. Thank you, David, for this opportunity, and to your team to share this information about Symphony and everything that we're doing in California to improve provider data. Let me move forward here, see if I have control. Testing the technology first. This is John McBride again that you're hearing, CTO at IHA. I'm going to be joined by Rod Shaw. He's with our partner Gain, and he's going to go over a little more depth about Gain Healthcare, one of our partners. And then very importantly, we're going to hear from the health plans and the providers who've been working with us for the last year or so in different capacities, but Christine Baer, and I guess we're going to do that at the end, and then Melissa Searle as well. So thank you for being with us, and thank you for having us. Let me see if I can move the agenda. Yeah, so the high level agenda will cover a little bit about IHA and our current statewide rollout, but then we're going to dive into the platform a little bit. So we want to have a specific focus on data and data quality. So for those who were involved last time, we're going to provide an update on where we are. And for those who haven't seen this, we'll certainly give you a primer and kind of show you where we are now. Very importantly, as I mentioned, we're going to hear from the actual providers and health plans about their experiences to date, and then hopefully we'll have saved some time for questions. So that'll be our goal. And similarly, just kind of a quick background here. The Integrated Healthcare Association, for those who haven't heard of us, or IHA, it's a nonprofit organization that convenes industry stakeholders such as health plans and provider organizations, purchasers and regulators, to solve industry challenges. So for the last 25 years, IHA has led a number of initiatives, including those focused on performance measurements and benchmarking. Some of you may be familiar with value-based pay for performance, or AMP program, and the California Cost and Quality Atlas. So we also focus on the workflow improvements or efficiencies across the healthcare industry. And it's really good. We have a large and diverse board that governs the type of work that we do. So you can see and hopefully recognize some of their logos on this slide, from health plans and care providers to employers and regulators, as I mentioned. What IHA really excels at is convening stakeholders from across the industry so that we can tackle issues collaboratively to ultimately drive consensus, meaningful action, and desired outcomes. So while IHA leads this provider directory initiative, the statewide initiative, we'd like to point out that we're really part of a large extended team of our vendor partners. And I'm highlighting Gain and Availity here, that you'll hear again more from and more about, but also the providers, the health plans, and the regulators. So we look at this as we're in a team, we're all working together to solve the bigger problem. So that's been our approach to date, and it's been working pretty well. We can't do this alone. Sorry, got ahead a little bit. A little bit of lag. Yeah, so again, a quick reminder, just to go back for some of you, but our vision is to streamline how plans, providers, and purchasers share and validate provider information, and to drive a centralized platform for California. So this is our long-term vision. It's our compass heading. So moving from the spaghetti diagram, I guess I'll call it, on the left of today's current state to the future state of a centralized source of truth. So Symphony, you can see in the middle there, and we really just want to streamline and make the process better and make it actually work. Apologize there, getting a little bit of lag. Okay, yeah, for those of you who followed our soft launch last year, this year, 2019, brought a continuation into our launch and statewide rollout at the beginning of this year. So this year has largely been about building a strong foundation with participation from health plans and provider organizations. We've seen some great momentum, and we have several major plans that are onboarding, including Blue Shield, Anthem, and HealthNet. They were also part of our soft launch, and as well as Aetna, Covered California, and many others. So as of this week, on the provider side, we have 59 provider groups contracted, which represent quite a number of providers. We're right about halfway through the first year, so it's been really exciting. We're also learning new insights about how to navigate existing processes within these large plans and groups, and how to truly implement Symphony in a high-touch way that also is scalable. So that's been our focus. All right. One of the crucial things that we knew we needed to do early on was to meet each client where they were. So in order to do this effectively, we've built up an exceptional customer success team. That's one of our differentiators, we believe, that partners with you and your organizations to understand your current systems and processes so that we can determine the best way for Symphony to add value to each organization, to your organization. The Symphony customer success team will be available to support you every step of the way, whether it's defining key milestones for your organization, whether it's business process consulting or change management or other. We're going to be there for you. Likewise, Gain's Symphony technical operations team works in partnership to ensure that we're able to meet, to accept data from plans and groups in pretty much any format you can send it to us. We can do it quickly. And then we're also aware that each plan or group needs to consume the data differently. So it's not necessarily all the same processes once we get internal to your system. So we're constantly learning from our clients, and I'd like to say that we're definitely seeing that each organization is different and that we need to be flexible and support them both in the small wins, but also helping to build something that's sustainable for the long term. So we're there from the beginning to the end. We're really glad in a minute we're going to hear from Christy and Melissa, as we mentioned on our webinar. We're really lucky to have them, and we'll get to hear more about their onboarding experiences firsthand. And in addition to embedding our customer success team to support your organization, a key factor to successfully onboarding with Symphony is ensuring that we have the right people to work with in your team. So we want to make sure that we bring our team. We're happy to be there, but we'll work with you to get people in place to align with the team that we bring. So this is generally what you're seeing here from an executive sponsor, a business process owner, from the project manager and lead, and data stewards. This is generally the mix that we've seen work out very well. And so it may not be the exact same, in every profile and every need in every situation, but this is something that we bring, and we want to make sure, again, that we're high touch, we meet you where you are, and that way we can make progress on solving the problems. Let me switch here. All right. Yeah, so last slide here before handing over to Raj. It's a quick recap on where we've been, where we are, and where we're headed. So Symphony is the result of what I believe is a true industry-wide collaboration. It's been really exciting to see the commitment to the collaboration continue beyond our soft launch last year and through the statewide rollout that we've had this year in 2019. We're focused on helping health plans and provider groups see the results as we build a foundation or a platform. And we're also working on the new and improved portal for small independent practice users, or really anyone who would benefit from a portal instead of bulk data exchange, such as SFTP. So Symphony's also been working closely with state and federal regulators, such as DMHC, the Department of Managed Healthcare, to ensure that Symphony meets all current compliance requirements and that we're staying up to date on any forthcoming requirements. So they've been extremely helpful in guiding us through the process. We'll continually monitor evolving regulatory and compliance matters as DMHC works to update SB 137, for example, over the next couple of years, and of course, as new bills emerge. In the meantime, we are laser focused on scaling Symphony up to be self-sustainable, to be a utility for everyone to use, and with a critical mass of participation in California, as you can see on the right-hand side, by 2023. So even though a lot of work has already been done, including work which preceded IHA involvement, we're still early into this journey. We're about halfway through the first year, as we mentioned, in our statewide rollout, and we hope to share more as we learn more, and we're happy to learn and share in two directions. We encourage you to subscribe to updates on our website so you can stay up to date with us, and we'll share more information at the conclusion of this presentation. I am going to hand over to Raj in a second here, and I'll let you walk through the platform.
Great, thanks, John. So I'm going to try to cover a number of topics. We'll talk about the platform, but I really want to focus in on some other areas that we previously haven't really spoken too much about around data quality. And let me share. John, I'm going to need you to, there we go. So I'm going to talk about information complexity and just talk about why this is a big player in why data quality is a challenge. I will talk about our data exchange process, but more specifically, I want to focus in on the maturity models that we're looking to implement with regard to data exchange, and then heavily focus in on data quality. We can talk about a couple of different areas around key challenges, the approach that we're looking to take, some analytics that we're starting to get insight into, and then start talking about some of the metrics that we're looking to track, and really how does that play a role with Symphony as well as our participants. So if you've heard us talk in the past, we talk often about our contract model, and we talk about the level of detail needed, the granularity of detail needed in order to support something like a provider directory. But there's another aspect of this that's become a big part of why data quality is a challenge in particular. And I'm just going to kind of look at some average information, average numbers when you start thinking about information complexity. So if we were to look at the marketplace of California, and let's just say there's roughly 120,000 providers in the marketplace, and just to say as an average, those providers operate on average 2 different service locations and contract possibly with 8 or more payers. Within those payers, there's usually multiple networks with the provider, so they may be participating in a commercial HMO business, a Medi-Cal line of business, as well as, let's say, Medicare. And then within those networks, there's typically multiple products. And for, I'm using an average of 4, but we've seen some payers that have far less, but many payers that have far more. When you think about that Cartesian product of information, that actually ends up resulting in over 23 million endpoints of information for something like accepting new patients. And that's not even factoring in things like specialty, which could add even more layers to it. So we're talking about having to reconcile large volumes of information. And when you factor in the contractual relationships about providers being with multiple groups and MSOs and ACOs and various health plans, then it's also about how do we go and find that information? Where do we need to go to validate all those different endpoints of data? So we're really talking about trying to solve this particular problem. And to me, data quality is really about how do we achieve solving this particular complexity challenge. We've shown these slides in kind of various parts and components before, but I really just want to quickly touch on the overarching data exchange process and how that plays a role in the way that we deal with our clients and with our participants. So we said this before, we are a multi-layered approach. We are all about consuming information from a variety of sources, provider groups, health plans, associations, reference sources, hospitals, all of which play their own key role in the information that we get within Symphony. Our back office then is doing a lot of different things with that data. We apply validation rules, and we have data policies, and then we have a whole team of stewards that are interacting with that data on a regular basis. And we've got an operational staff that's really there to help facilitate presenting that information back to our clients and our participants through a variety of tools, depending on need and purpose. There's a word, kind of a phrase that we've coined in the past, fit for purpose, which is really about how do we get information back to you in a meaningful way for the desired purpose that is needed to be intended for. And really what we are doing is we are providing a framework to be built around your processes and workflows. I've said this a number of times for folks that have heard me talk about it. We're not about ripping and replacing. We're about building around and collaborating. And it's really this framework that is a key cornerstone for what Symphony is trying to accomplish. And it's really the way it needs to be dealt with when you're trying to talk about building a statewide utility, especially as large as California. I'm not going to go into this slide into too much detail as far as the individual components, but I do want to talk about data process maturity, because this is really an important critical piece for how health plans and especially provider groups get to a level of maturity where we are actually exchanging information in a way that is more meaningful than the current state of things today. When we look at the current state of things today, and let's say we took a provider organization that joined and participates with Symphony, we still live in a very much Excel-based world. We have payers that have their own ways of doing things. They send out rosters to provider groups. We are still dealing with that large bulk exchange. It's generally being done quarterly, which means we're dealing with high volumes of changes. And it's really a very administratively burdensome process. And it's one where it's really our current state. It's where we're starting off with things. But now as we have the payers coming on board to Symphony, we're starting to get into this initial maturity model. Right off the bat, we can't streamline everything, but we can be a facilitator, and we can be more of a middleman to help support the providers and the health plans by still being able to deal with those roster exchanges, but being able to help streamline the process a bit more, being able to be the conduit to receive those rosters from the payers, give those to the groups, being able to submit those back to the payers, and really kind of becoming the fundamental component in the middle. Where we go from there is really more of what we call a moderate maturity level. This is where we can start to look at how do we bring down the cadence from a quarterly process more down to a weekly process. And as a part of that, how do we then utilize the data from the payer as well as the groups to be able to facilitate the exchange of information and start to break away from some of the legacy processes. When we have a provider organization that's comfortable with our process, with the way we reconcile information, and we understand how the payers need to consume that data with their existing roster processes or Excel-based exchanges, we can then be that facilitator and start to streamline that process. And we can do it more frequently, giving the payers the information on a more regular basis that helps them deal with it from a compliance perspective, but also from a data quality perspective. But ideally, we want to move into a more optimal model where we are still kind of dealing with that weekly exchange of information. From a provider group perspective, we've gotten them to the level of maturity that we kind of feel that they needed to be at. But with the payers, we can start to look at how do we then move away from that older way of exchanging information, looking at how we can get to a more transactional process, one that can introduce automation and internalizing that data within the payer walls. We can figure out what is still manual and needs to be dealt with versus what can be processed through more automation, what tools are needed to support that. And when we get into that model, we're getting into a really optimal maturity of data exchange, which is then going to drive our data quality, which I'll talk about is how we're measuring that. But it's really about trying to get someone through this process. And the important part is that we understand that everyone's at different parts of this process. There are different levels of that maturity, and we work with you to figure out how do we get you from A to Z, and what does that plan look like? So when we talk about data quality, I think the first thing we want to understand is where are the challenges? What have we been seeing now having worked with a variety of organizations for a long period of time? And by far, one of the biggest problems is definitions and just the granularity of information. When we look at this, there are all these interactions happening between providers and payers. There's just a fundamental challenge about how information is interpreted and how that information is even represented. And what we're trying to do by having a centralized collaborative model is we're trying to drive towards standards and common terminology, which is really going to help us then figure out, do we have the right level of detail and information to support everyone's needs? And when we start talking about things like products and networks, everyone has different interpretations of those things, and the level of detail we get varies depending on who you are and what information you have. So we're really trying to deal with that level of granularity and also put some definition around that process. The other really big problem we've seen is just how folks consume data. The internalizing of information doesn't matter if you're a provider or you're a payer. It's a struggle, it's a challenge. Much of it's still very manual. There are things that are automated, but they require different processes. One of the things that we are spending a significant amount of time doing with our customer success team is understanding what is everyone's process. I'll say this, there's no one cookie cutter way of doing things. And it takes a utility like this to be able to support that level of touch
with each of our clients to be able to figure out the right way for you to deal with the information and the right way for us to present that to you so that it's meaningful. The other big challenge is this concept of process modernization. So we're trying to move to a higher level of maturity in the way we do exchanging of information and validation. But the reality is we still got to deal with what's still out there. So we're kind of living with two different worlds right now. And that requires for a period of time for there to be more effort, potentially more resource involved, because we still need to support what's happening today while we drive towards a future state. But the nice part about the way we've developed our framework and the model of Symphony is that we can evolve you over that maturity iterations, and they can be very tailored to your organization. So not everyone has to go through that model at the same pace. The other big issue is just the perception of quality in general, and what I'm going to refer to as the trust issue. So we've had years of bad data, years of bad processes. We hear about it all the time, audits and reports and articles and conferences, and we've talked about it so much. What that's actually led to is the marketplace having a real trust problem about what is the source of truth of information and what is quality, and where do I need to go to get that information. I think by having a central utility, our goal is to define a quality methodology that all of our participants can align to, that they can also contribute to, and it really leaves no ambiguity into the way that we're dealing with information. I think transparency is likely the biggest key for us being able to break down that trust barrier. I do want to talk a little bit about the approach that we've been developing and looking to implement. It's something that's been evolving over a long period of time, but it's really important because if we have this process in place and everyone's fundamentally understanding that process, it's really how we can drive towards that improved quality of information. It begins with definition, being able to understand what are those key metrics we're trying to track, what are those KPIs, and that's really going to be fundamentally driven off of our data policy. But then it's about how do we evaluate that information? How do we analyze it? How do we report on it? And how do we present that back to our clients so that they can understand where they are with regard to those defined metrics? And then from that business process standpoint, it's really about how do we figure out a way to improve on that? How do we understand what you do? How do you consume information? How do you internalize it? What are your workflows? And then putting together an improvement plan so that over a period of time, we can then implement and integrate that data into your process. Because from there, we can actually start to look at controlling it. We can start to monitor those metrics over periods of time. We can figure out what changes are being accepted, what are the things that are not getting updated, why are they not getting updated, and how do we work with you to put together a plan so that we can help improve that over a period of time. I think it may have skipped over one here. Yep. So then the next layer to this within sort of the data quality spectrum is how do we start segmenting information? And when we start looking at metrics and defining those metrics, we want to look at things that are impactful to the consumer, to all of us, to the patients, to the members, because it's really been the fundamental problem for this whole provider directory issue. And we break it down into sort of three categories: high, medium, and low impact. The things that we look at in sort of a high impact category are going to things that have significant impact to the consumer, and they really should be addressed immediately. These are things like providers that are not really actively practicing anymore for a number of reasons, or service locations that are incorrect, or providers that are missing from directories, or providers that need to be added to directories, all of which have very large impact. When we start looking at medium impact issues, we're starting to look at things that really cause more confusion than anything else. Doesn't necessarily impede on access to care, but it could delay it, or it could cause some issues to get to it. Having the wrong phone or fax number at a service location, mislabeling information, having specialties or hospitals that we can't quite identify. Those are going to be things that certainly need to be addressed and they do tend to cause confusion for the consumer. Then there's the things that are low impact. Those are going to be items that don't necessarily have direct impact to the consumer, but they are considered data quality problems. The simple use case I have is, a provider who has an organizational NPI on their personal record. Do consumers search by that information? Not really, but it's a data quality problem. It may have operational problems for you as far as claims payment and other issues, and it's things that should still be addressed. I want to look at two different areas, and then I'll hand it back over to John here. The first is I wanted to look at what I'm going to call insight analytics. It's one of the benefits of having a centralized model like this, where we get data from all these various sources. We can start to see things across a spectrum. And this is a real use case that was pulled. We're looking at information from 5 different payers in a provider organization, which was 9 records of information. And I'm going to sort of de-identify and say it was Jane Doe, and it's information about where she's currently practicing out of. 2 of the 5 health plans are saying that that provider is in a San Diego location, while the other is saying that she's out of a single location in San Francisco. And additionally, health plan number 4 on here has both San Diego and San Francisco listed for that provider. Is that incorrect? Possibly not, but the reality is it's suspect information. And because we can kind of see this across a spectrum, we can start to identify these types of anomalies. We can put this type of logic and analytics across a lot of different types of metrics. But in this case, we can say this probably doesn't make sense. We know who's involved with this provider. And then if we can start layering in additional information, like when was this information last updated? Do I have reference data to start corroborating some of this information? Do I want to put in other data policy checks that are going to help me further define what is the right answer to this question? And additionally, if I get Jane Doe involved in the process by having her have an attested record through our portal and through our process, I can whittle down the answer to the question, where is Jane Doe actually practicing out of? And more specifically, I now know who to tell about that bad piece of information. And this is the type of model where we can be doing analytics in the background that no single organization could necessarily do because they don't have access to all the data. But we can be doing it and be doing it proactively. So we're identifying things that are of issue that should be getting back to the payers and the providers to be addressed. Previously, I was talking about the impact levels of some of those metrics, high, medium, and low. If we just look within some of the high impact areas, we just look at a sampling of 115,000 provider records, we can start to see where there's some anomalies that take place. So we had about 1.2% of those providers that had some sort of major provider identification issue. In some cases, they had multiple hits. So really what that means for the consumers is that they're trying to potentially access providers that are just not available. It could be because they've been sanctioned or they've retired, they've passed away, something that's of a critical nature that really needs to be addressed by the payers because it has impact to access of care. Another area we saw some spike in was, as high as 3% of the providers were being listed with specialty taxonomies that weren't in line with their medical degree or training. So for a consumer who's trying to look for a particular specialist or a particular provider, to thinking that they are getting the right person when they're really not, that's obviously a big impact to care, and it can cause some major issues. We took a smaller sampling and looked at some examples between some provider organizations and some health plans, and we started to see, variations as high as 3.5% between 2 particular contracted endpoints where the accepting new patient status was incorrect. So to the extent that a consumer is looking at an online directory thinking that they can go see this provider, calling that provider or going to that service location and finding out that's not the case, obviously a big impact. And even vice versa, where it says they're not accepting patients, but they really are. That's limiting their ability to get access to care. And there's even some simple checks to see that we have hundreds of service locations being listed in directories that are actually PO boxes. no, needless to say, if you're trying to go and access care at a PO box, it's likely not going to happen. So these are some of the areas that we're starting to see what we call high impact. There's a lot of other metrics that we're defining underneath this. It's something that we're starting to roll out across all of Symphony. It'll be an area where we will focus heavily on with all of our clients over the back half of 2019 and really start to track and measure that so we can show improvement of quality, which then drives towards what we call better accuracy of information. With that, I'm going to go ahead and hand this back over to John.
All right. Thank you so much, Raj. It's great to have you share that information. I think it's important for all of us. And I'm also very thankful that Christine and Melissa are here, and we get to hear what they do. So this is directly from their experiences. So hello, Christine, and hello, Melissa. I hope you're there.
Yep, afternoon, it's Melissa, I'm here.
All right, great to have you. Why don't we start off, we'll just kind of go back and forth maybe, but feel free to chime in if you have anything that you want to add. But Christine, why don't we start off if you tell us a little bit about your background and your involvement with the Symphony Provider Directory.
Sure. My name is Christy Beyer, and I'm an IT executive advisor supporting Anthem's provider executive leadership team. I'm intimately involved in our provider data strategy and strategic initiatives that improve our overall provider experience. Very deeply engaged in the Symphony project. I've been partnering closely with our IHA and GAIN partners to ensure that we have the appropriate Anthem subject matter experts engaged while we continue to work through both the discovery and onboarding pieces.
That's perfect. Thank you, Christine. And Melissa, how would you like to tell us a little bit about your background?
Sure, I can tell you what my background and sort of how I got involved in our provider directory as well as my involvement with Symphony. So I'm Melissa Searle. I'm the Senior Director of Compliance with Hill Physicians. So Hill, we're an IPA, and we contract with providers downstream and health plans upstream. That means that we exchange provider data. We get audited on our data by our plans. So I became involved with our internal provider data in our directory when SB 137 was passed, since it was a regulation that went through compliance. And it was at this time that it really caused us to take a deep look at our data and our processes internally and externally with our providers and plans and how we exchange and maintain that data. What we discovered was that it was going to be really difficult to fully comply with SB 137 in the way that we were maintaining and exchanging data at the time. So very conveniently, we were connected with IHA, and we ended up becoming a participant in the PDU pilot. And, it's just been beneficial from that point onward. So from early 2018 till now, we've really come a long way in our data accuracy and development of more efficient processes.
All right. Well, thank you. I mean, we appreciate the collaboration. I mean, it's so exciting to be able to work on such a large problem together, and I think kind of collaborate across, every kind of spectrum we can think of. So thank you both for being part of Symphony and being part of this webinar. So Christine, why don't we go back to you, and why don't we talk a little bit about before Symphony? What were some of the biggest challenges or perhaps frustrations that you or your team faced in managing the provider data? So sort of a before Symphony, what was that like?
Sure, so absolutely. I think when we think about provider data, our biggest challenge as a health plan is the lack of updates received when a provider's data changes. And then the other part of that is the accuracy of the update when changes are made. So we understand that, it's a pretty cumbersome process for providers to make sure that their data is updated, especially when they're working with multiple payers. And it's why it's so important for us to focus on easy-to-use tools that are multi-payer tools and really enable increased frequency of data updates and ensure that we've got an overall quality of the provider data being updated.
That's fantastic that we're being able to focus on those things. Melissa, how about you? Like thinking about Symphony. So before Symphony, what were you facing from your side of the world?
So we're in an interesting position as an IPA since we're sort of situated between the provider and the plan. So we experience the frustrations as a provider, but we also experience it, we know what the payers are going through as well. So we found that, before Symphony, it was very complex. It was very decentralized. As Hill, we have the responsibility to gather and maintain the provider data for our providers, but only at their contracted locations and for the contracted services. But our providers are having, when they're contracted with plans directly or when they're contracted with other IPAs, they're also supplying their information that way. And then you've got third parties as well who are reaching out to us as well as our providers trying to collect this data. And so having all of these various, individuals and parties collecting the same but also different data really made it convoluted for us. And so our providers are becoming frustrated. It was also frustrating for us as well as our plan partners. As part of our process, we would send, and we still do for those plans who are not with Symphony, but we send our provider data on a weekly basis to our plan partners, which includes our ads, our terms, and our changes. But when we would get audited during our roster audits or when there'd be data review with our plan partners, we find that our data didn't match with our plan partners, even though we had this process to send it on a weekly basis. And I think because it was so decentralized and complex, the plans and Hill are trying to maintain data coming at us from all these different sources. Then you throw in these third parties who get alternative information that sort of convolutes it as well. We also found that not everyone was maintaining the data in a consistent format. So, we were capturing panel status differently. And so as a result, file formats weren't picking up. We may be sending it in one way and the plan maybe hadn't updated yet, or we were sending it one way and it wasn't compatible files as we were sending it back and forth. And there was a lot of frustrations with that as well. So I think just having, such our own individual processes and not really, standardizing or having a uniform way to exchange and maintain data, it just sort of frustrates the entire industry, all players, and no one's at fault. It's just the fact that it's so decentralized. And so another interesting thing, looking back now, I realized one of our frustrations is that, we didn't really have, other than reaching out to the provider, we didn't have a real verification that our data was accurate. And so even when all the parties agreed, so when we had the accurate data and the plans had the same matching data that we did, it could have still been wrong. And we didn't have a way to verify that unless we went out and, did our quarterly attestation, but that was, every 90 days to get this information that it was incorrect. So for example, if Hill had a gender as a female for one of our providers, and so did the auditing plan because, whether they took that from us or from somebody else, but the provider was actually a male, there'd be no reason for us to question it because our data matched our plan partner. So unless the provider changed it in one of their attestations, we would have never known. But now we know because every week we get a file that shows us that is the wrong gender. So it's just, there was no way for us to really verify. So there was a lot of frustrations, and I think that Symphony's really been great at addressing those.
Yeah, and we have this shared, I'll say frustration, maybe definitely complexity and format. So I think back to the point, it's like we shared, this level of complexity that we're dealing with, searching for the same outcome. So I guess that was the common ground that might have connected everybody, perhaps. So thinking, I guess now, if both of you would think a little bit about where we're going with Symphony, so especially your experiences thus far, how, Christine, we'll go to you first, but how has it benefited your organization, or how do you see it benefiting your organization as we move forward? And perhaps thinking about even some lessons learned. Christine.
Yeah, so we're still kind of wrapping up some of our discovery activities. We definitely see the light at the end of the tunnel when we kind of get onboarded and fully integrated. But just in terms of kind of helping you understand like our experience, with Symphony so far, we're getting through the process. It took a little bit longer. We're dealing with a lot of complex information and a high volume of information. So, having worked through a lot of those due diligence on the issues and how things can be streamlined, are benefiting us greatly now that we are shifting over to, kind of moving into that project execution mode, if you will. And a big part of the solution that we're looking on here at the Anthem side is really the automation of the data that we're going to receive back from Symphony. And so not only are we sending our data out so that it can get validated and checked, we're receiving it back in. And by taking the time now to have, the solution have the appropriate tags so that it can come into our system, be updated in an automated fashion, and then also put into the appropriate work queue so that we're really aligned with our current operational processes. By having done so much due diligence there, it definitely is going to help us when we are, fully executing, to be able to leverage that great work, in place now.
Yeah, so that's good.
Sorry?
Yeah, I was saying that's good. So it sounds like you'll be able to automate and get better data. So it sounds like a double win.
It is. Like when we had gone through the pilot, one of the things that we found is that, it really exposed us to the accuracy of some of the data and information that we had. I think Raj did a good job of kind of illustrating some of the pain points and challenges that you guys are really, embracing. But when you come back and you send that data and get it validated and it comes back, if you're anticipating, large volumes, or we have to be able to get those incorporated appropriately. So we've spent a lot of time, working through what that process is to create the channels to send it out, get it back, but we needed to make sure that we could support making those changes back into our systems very efficiently. And so that's why we spent so much additional time here in discovery to make sure that even when we are fully onboarded, that it's automated and streamlined here with our existing operational processes.
Very good. So Melissa, you want to weigh in, and what about your experience with Symphony and maybe the benefits that you see or have seen?
So our experience, I kind of want to start with the customer service experience first, because I think that's been so great. We've had a lot of questions and a lot of feedback as well. And Symphony they've always been timely, and they've always provided really valuable responses. And I know that we're just, one of the many customers, but you almost feel like you're the only customer because of how attentive Symphony is to us and our questions. And I think that's just been really great. So other thing, so I also want to say that, a lot of times I think organizations try to fit new initiatives into the current workflows, but that didn't work for us. And I think, similar to Christine, we've had to change our workflows and our processes to align more closely with Symphony, as opposed to the other way around, making Symphony align with us. And that's been beneficial because, we probably wouldn't have looked so closely at changing our processes, maybe so significantly, but it needed to happen in order to, become standardized and, go where the industry needs to go. Another lesson I think we've learned is, you don't know what you don't know. And, we've always prided ourselves on having great and accurate data, which, it still is, but now we can identify more quickly where there are instances where it's not accurate. And so we've made some really significant leaps in fixing our provider data discrepancies and, learned how to do that more efficiently. Whereas, before we didn't do that because we didn't know about them. So I think that it's just been a great experience so far, and we've centralized not only as an industry are we centralizing and standardizing, but internally at Hill, it's given us the opportunity to do that as well.
Thank you. Yeah, it sounds like, from both the health plan and the provider side, it's a journey that we go through, and it will be a continual journey as we all improve, especially thinking statewide. So having thought about that, what do either of you, when you think about advice that you would give to others? So you've made changes internally, definitely there was a lot of work, and we know that, but thinking about other plans or providers who are considering coming on board, what would you share with them that might be helpful just from getting onto Symphony? Christine, do you want to take that first?
Sure. So I think, especially when you think from a payer's perspective, just a few lessons learned, I'd say, focus on keeping it simple. We've got a lot of data attributes that are available, but, focus on those key elements and kind of go from there. But the biggest thing I would say is I encourage everyone to get on board. We all benefit when we reach that sufficient mass of payers and providers using the tool, and it can only increase our overall experience. So, from our standpoint, we see the benefits in making it streamlined for providers. We've got a lot of complex information and a high volume that we're dealing with. So, having a tool that we can integrate with to, help us ensure that data is being reviewed, it's being validated, it's more accurate. We ultimately can create a much better provider experience with good quality data. And so my advice, if you're considering it, is hop on board.
All right, Christine, we agree with you. I think this is one of those where the more people that are on board, obviously the value just continually increases. So that is some good advice. Melissa, what are you thinking about advice that you would give?
So yes, I definitely agree. Other than jumping on board, because like what Christine said, the more people we have, then the better the data will be, and the more benefit we'll see for the industry. So that, of course, is first and foremost. But I encourage everybody to really take advantage of the onboarding process. You're only going to get that chance once, and that's sort of your chance to get your data right, get your files correct, work out your workflows, and don't be hesitant to change your workflows and your internal processes, and really use that onboarding period to look at what are you doing and how can you make that more efficient. And your first reaction might be, this isn't going to work for us, or this is difficult, or how are we going to fit these weekly files into what we're already doing? And the answer is you don't. You really look at that onboarding period and you think, okay, how can we make ourselves more efficient? Because this is working, and we, as Hill, being part of the pilot, we can really attest that you do have to change some of your processes, and when you do, you're going to see a benefit, and you're going to find efficiencies that you never thought you were going to find before. You're going to find data that you never thought was inaccurate. So just take advantage of that period to really look at your data and your processes and see what you can just improve and make better by joining this provider directory utility.
Well, fantastic. Yeah, I think it is change, and I know in healthcare especially, it seems like change is tough, all the way around. So it's good to hear that it seems worth it, like we're headed in the right direction. Just hearing the feedback. We want to continue that, looking at it as a team sport, so to speak. But thank you, for just being here, being part of this. And if you don't mind sticking around a few more minutes, and Raj as well, I think is still there. We are going to move to any questions, if there are any. As we kind of transition to that, we definitely want to invite everybody to join the movement. So this is definitely a movement. It's about the whole state. It's California. We want to make sure that you can ask us any questions that you have. We're happy to answer those. If we don't have it today, we can certainly get it for you. And we also just want to hear ideas. We don't know everything. So if you have some idea, if you have something you'd like to share with us, we're open to that as well. So hopefully you can see the information here, the website that you can go to for Symphony. You can certainly email us, and we're just happy to interact any way that you'd like to. So we certainly appreciate having Christine and Raj and Melissa on today. And David, or I'll hand this back over basically for some Q&A if we have some questions out there.
Yeah, and we do. We've got quite a few questions, and unfortunately, far more questions than I think the last 6 minutes here will allow. But I do want to get to a few that have come up a couple of times. One, I think that just dovetails nicely with what you were just talking about, which is we do have some providers on this call today who are writing in and saying, sounds great, how do I get a demo?
Man, Raj, I'll let you, you can email us, number one, but Raj, do you want to tell them how to schedule a demo?
Yeah, well, I would say do just that. Do reach out to the contact information here on this page. We can have somebody reach out and figure out what's the right scheduling and who all needs to be involved in a demo. But we're happy to do those. We just want to make sure we coordinate it through the right channels within IHA.
Yep, sounds perfect. And we'll get back, and we're happy to do demos. That's for sure.
Another question that has come up a couple of times is whether the data that you're recording is just for commercial provider networks, or whether you're also getting information about Medi-Cal, managed care, Medicare Advantage, those sorts of things.
Yeah, it includes all lines of business, both state and federal. We're not limited by any particular area or line of business.
Okay. And then we've had a few questions that I'm going to sort of try to encapsulate into one, which is about reconciling data between what the provider might provide and what the plan might provide. I think we've all seen the circumstances where, for example, the plan might say there's providers in the network and the provider says they don't participate in that network. How you reconcile that?
Sure, I can maybe take a quick note on that one. So there's a couple of layers to that. The first being by having the data in from the participating organizations, we can first facilitate the reconciliation and try to figure out where are the discrepancies. The second piece of it is just being able to notify the parties involved. Really, it's, there is obviously contractual relationships and there's other factors into why a provider is or isn't being listed in a particular network. But we really want to go back to the people that deal with that provider, whether it's a provider directly or it's through a provider organization. We want to basically bring those people into the fold. And so part of this whole data exchange process is highlighting those things, notifying the parties involved, and then really facilitating the reconciliation workflow. And I don't know if maybe Melissa or anyone else has a note on that, but that's something that we try to do and establish as part of the routine workflow.
Right. Yeah. I just will echo Raj that it's, any discrepancies like that, we work out with either the plan or we work out with through Symphony. And we just follow the workflows that have been established through Symphony to work out those issues, which is another great benefit of Symphony is that, you don't have all these piecemeal emails going back and forth. You can just do it directly through the platform.
Okay, so I'm looking through, we actually have gotten a lot of questions. I guess this one, it definitely bears asking, which is, we've had some providers ask if there is a cost associated with a provider putting their data in Symphony.
Yeah, so just from the cost side, first and foremost, this is something where this year we are subsidizing, or it's paid for this year when you come on board. So there's obviously a cost, but we're bearing the burden of that right now. Second, I would say we're making a utility model, so we don't want cost to become a barrier. So that's probably the most important thing to say. We're a nonprofit at IHA. Certainly we're looking at this as something that has to work from the smallest, provider up to the largest organization that we can think of. Having said that, generally speaking, the providers are going to pay a little bit less, and the health plans, pay kind of a provider fee. And it kind of depends on complexity and size as far as how much someone would pay. So, that would be something that we could talk to you about. And Raj, certainly jump in there too as well.
Yeah, and I think just one other note to that is our expectation was not that individual practitioners or small practices necessarily be paying for this. I think we're looking at the larger organizations from a provider side, so larger provider groups, as well as the payers.
Yeah, that's a great point.
And I think with that, and I feel bad because we are still getting questions rolling in, but I am seeing that we are rapidly approaching the top of the hour. So for everyone whose questions didn't get answered, know that we are going to be downloading all of these questions that have come in after the end of the broadcast and providing them to IHA to hopefully get some of the common ones into some sort of FAQ or something after the end of the broadcast. So with that, I would like to thank everyone for your time today, especially our panelists who have taking their time to be part of this and to construct this presentation. And everyone who's been on, I hope you enjoyed the presentation and be looking out for more CalHIPSO webinars in the future. Thanks everyone for your time.
Thank you.